I am Dr. Balakrishnan, Professor and Head of Unit 2, Department of ENT, Kasturba Hospital, Manipal. And I'm here to talk about sinus infection or sinusitis. Basically, sinuses are empty spaces in the skull bone, which is seen in the facial bones. And these empty spaces are lined by mucosa and are connected to the nasal cavity. So whenever there is inflammation of the nasal cavity, mucosa, this is called rhinitis, they can develop sinusitis. So infection of the sinuses or inflammation of sinus is called sinusitis. So how can we identify this person has got sinusitis? So these patients usually have a preceding cold or upper respiratory tract infection like a viral fever or any other forms of allergies or vasomotor responses and can develop nasal blockage, rhinorrhea, this nasal discharge, and eventually may develop facial pains or pressure symptoms of the face or head or heaviness of the head, and eventually may develop thick, purulent or what is called a yellowish postnasal discharge, and these are pathognomonic of sinusitis. Sinusitis could be acute or it could be chronic or it could be recurrent. Acute are short-lived, less than 12 weeks duration, and chronic is where it's more than 12 weeks duration. So on examination, what we find is that the nasal mucosa inside of the nose is red and swollen. It's called edematous, and there will be purulent discharge or mucopurulent discharge in the nasal cavity, especially in areas called as the middle meatus or the superior meatus. So this is how we diagnose sinusitis, and in acute sinusitis they may have pain on or tenderness on pressure over the sinuses, and these sinuses can be quite dangerous, especially in children, because this infection can spread into the eyes. Eye is this neighbor of the nose, or it can spread even to the anterocranial fossa or the brain, and they can develop complications, especially in children. So how do we manage these patients? So we do investigate these patients by either a nasal endoscopy. We pass a thin scope into the nose and find out what is wrong inside the nasal cavity. We try to identify what is the trigger factor, what is the causative factor. It could be allergy, it could be just a simple viral infection, or it could be a deviated nasal septum or a nasal mass. So we need to detect that by nasal endoscopy. And then sometimes especially in chronic sinusitis, when they're not responding to medical treatment, we treat them with, we do a CT imaging of the paranasal sinuses. Ultimately, the aim of treatment is to reduce the congestion in the nasal cavity or the swelling inside the nasal cavity and allow the mucus that is there in the sinuses to drain easily through the nasal cavity. For that, we use a lot of medications like antibiotics if it is infected. We give anti-inflammatory nasal sprays like the steroid nasal sprays, antihistaminics to reduce the mucus secretion, and also mucolytics to lyse the mucus. And most importantly, we do advise them to do what is called as nasal wash. They wash the nose with saline so that thick mucus is aided to come out of the nasal cavity and helps in opening up the nose as well as the paranasal sinuses. If the patients are not responding to these conservative measures, then they are taken up for surgical intervention where the sinuses are opened up endoscopically by a surgery called Functional Endoscopic Sinus Surgery. And all these sinuses actually drain into the nasal cavity by a very thin mucociliary mechanism where the cilia beats towards the nasal cavity. So the aim of the surgery is to restore the mobility of the motility of the nasociliary mechanism. Thank you very much.